Infertility. Infertility is defined as the inability of a couple to conceive in spite of 1 year of frequent unprotected intercourse where the woman is less or greater than 35 years of age. Sterility is an absolute state of inability to conceive, whereas infertility is the inability in 1 year to conceive. Okay. So causes of infertility, it may be physiological and pathological. Physiological factors like pre-menarche, post-menopause, that is after the stoppage of the menstrual cycle, and third could be the lactation period where the mother is feeding the baby. Pathological factors, maybe male factors is 30 to 40%, female factors 40 to 50%, and both could be 10%, whereas some other unknown causes are also there, which is 10%. Talking about the male factors, like the defective is spermatogenesis, obstruction of efferent duct system, failure to deposit sperm high in the vagina, and errors in the seminal fluid. So these are the causes of male factors. Female factors like ovulation factors, tubal factors, uterine or cervical factors, peritoneal factors, and unexplained or physiological factors. Ovulation factors like the aging, anovulation, luteal phase defect, PCOS, POF, endocrine disorder, tobacco use, unruptured follicle, obstruction or blockage of endometriosis, congenital uterine anomaly, fibroids, polyps, uterine syncytial, that is also known as Asherman syndrome, pinhole loss, peritubal adhesions, endometriosis, are all the female factors. Now coming to the investigation of infertility, clinical assessment of both partners like age, occupation, previous marriages, history of any illness and operations, appendicitis, peritonitis, tuberculosis, chlamydia, head injury, and all these are investigations to be done. Abnormalities of penis, cryptorchidism, size and consistency of testis, epididymis, presence of vasa, varicocele, and prostate abnormality in men. In women, asses, vagina size, position, mobility of uterus, enlargement of fixation of adnexa, assessment like the body mass index, basal hormone evaluation, ultrasonography, hormone assays, endometrial biopsy or carotid could be assessed for the investigation of infertility. Talking about some of the management of infertility, like the management of ovulatory dysfunction, management of tubal, uterine, pelvic diseases, management of persistent infertility, and natural boosters of fertility like the multigrain diet, protein, fruits, water, exercise, vegetables. These are all the natural boosters. An ovulatory dysfunction could be the underlying cause should be treated, like the thyroid dysfunction could be the reason of ovulatory dysfunction. An insulin sensitizing agent like metformin induces ovulation in PCOS patients. So in PCOS patients, insulin to be given. Now the management of tubal, uterine, and pelvic diseases. Tubal block may be treated with reparative surgery, but it has increased risk of ectopic pregnancy. IVF is an alternative. Management of persistent infertility. Treatment options include IUI and clomiphene citrate or gonadotropin therapy. IVF may be useful in patients with persistent infertility. Natural boosters, I already told, multigrain diet like ragi, oats, millets, pulse, soybean, legumes, milk, carrot, almonds, beetroot. Now, talking about some of the methods to cure the infertility is the assisted. First one, we'll talk about the intrauterine insemination. These are all called the ART, that is assisted reproductive technology. Intrauterine insemination, that is IUI, is a fertility treatment where sperm are placed directly into a woman uterus. During natural conception, sperm have to travel from the vagina through the cervix into the uterus and to the fallopian tube. With IUI, sperm are washed and concentrated and placed directly into the uterus, which puts them closer to the egg. In some cases, couple may begin with IUI before progressing to IVF if needed. Before progressing to IVF, we can also go for IUI for as a measure. In vitro fertilization, that IVF we are talking about, it involves retrieving eggs from women ovary and fertilizing them with sperm. This fertilized egg is known as embryo, and the embryo can be frozen for storage or transfer to a woman uterus. Depending upon the situation, IVF can use the eggs and the sperm of concerned couple, donor eggs and sperm of the man, eggs of the women and donor sperm, donor egg and donor sperm, and donated embryos. Embryo may also be implanted in a surrogate or gestational carrier. This is a woman who carries your baby for someone else for a duration of time. There are certain steps in the procedure of the IVF. Some of these steps, that is total 5 steps involved in vitro fertilization. First is ovarian stimulation. Second is follicular aspiration. Third is insemination. Fourth, embryo culture. Fifth is embryo transfer. So these are the 5 steps. Discussing each of these steps. First, we will talk about the ovarian stimulation. In ovarian stimulation, women normally produces 1 egg during each menstrual cycle. However, IVF requires multiple eggs. Using multiple eggs increases the chances of developing a viable embryo. Therefore, fertility drugs are given. Other method of ART is gamete intrafallopian transfer, zygote intrafallopian transfer, intracytoplasmic semen insemination, aspiration of oocyte following ovulation induction either laparoscopically or under TVUS. This procedure is different from IVF in the sense that in IVF the embryo is transferred inside the endometrial cavity, while in case of GIFT the gametes are transferred into the fallopian tube. ZIFT is a combination of IVF and GIFT. An ICSI revolutionized management of male fertility. A single live sperm is injected into the cytoplasm of the oocyte, where then it's incubated overnight and is nowadays used as a part of IVF cycle. So among all, this is the ICSI that is common these days, which is used as in vitro fertilization cycle. Indications were to be given where sperm count is less than 5 million per milliliter, immotile sperm, abnormal sperm morphology, obstructive or non-obstructive azoospermia, previous failed IVF and unexplained infertility could be the indication where ICSI is to be given. So up to this we talked about the infertility art and where to be indicated. Thank you for watching my channel. Please do subscribe for more such videos.